Hi, welcome to Soulprint Intuitive Tarot. It is February 5th, and I'm very happy that you have chosen to spend some time with me. Before I get going, I do want to send out a thank you to all of those people who continue to subscribe and support my channel, who continue to comment, give thumbs up, and share it. It means a great deal. These are very, very volatile times, and so anything that I can do to sort of calm the waters, I hope to be able to do. And sometimes doing that, unfortunately, ruffles a few feathers, and that's okay too. So, for those of you who follow my channel regularly, you know that I really don't tend to deviate off of politics too far. You will never find a Meghan and Harry reading here. That's sort of not what I do, and that's not why I started the channel. But things that are around the area of politics, I'm going to look at it, and today that's one of those readings. Today I want to take a look at the United States health care system. There is a lot of push and pull about how that should be done. There's a lot of really good ideas about how we can make this, your country can make this work, implement things that will be helpful to a lot of people. Now, I'm just going to preface this by saying, again, that I am Canadian. So like England or Britain and like Australia, etc., we have, established sort of healthcare systems in place. They're part of what we have that's provided, I guess you could say, or supported by the government. So there are some things that I don't understand about how your system works and why it kind of works the way it works, because it really is outside of my frame of reference. So as much as possible, I will do my level best to keep my own thoughts and theories and opinions out of this reading, and I will do my level best to try to bring clarity into an environment that I don't have great clarity on, because I'm not a participant in your services. I do know that for a lot of people who, are thinking about maybe moving to your fair country, especially if they come from countries that already have established healthcare, it becomes one of those huge things. It's like, oh my God, like, how do you function without established healthcare that's not costing you an arm and a leg? So it's one of those things that people around the world kind of are a bit confused by. But let's take a look. So that's my question for today. Let's see what we see, shall we? Come on down, I have a question. So I would like to gain some insights about the U.S. healthcare system, and you'll notice I'm very specifically calling it healthcare as opposed to Obamacare or Medicaid. I'm trying to give it a more neutral flavor, and I'm not sure what's going to come out in this reading or how it's going to come out, but I do caution you to please not take anything I say as an indicator of the election, an indicator of who's likely to win the election, and whether that is Democrat or, God forbid, Republican. Okay, this is just overall insight, information, and guidance on what you can most likely to expect from your U.S. healthcare system. Here we go. U.S. healthcare, U.S. healthcare, U.S. healthcare. Okay, so let's start where we started. And again, I mean no disrespect to your systems. I am interpreting what I see here to the best of my knowledge and my frame of reference. When your healthcare system originally got started, when hospitals were being built in those big city centers that were established way back when, was that the middle 1800s? Was it the end of the 1800s? But when those hospitals, et cetera, started to be established, they were very much set up as a business model, right? A hospital was just another business. It was no different than a grocery store. It was no different than a bank, no different than anything else. It was a business. Well, what has happened then is that it, of course, has evolved. The your medical system has become, it is operated and functions as a business, and so basically what I'm trying to say is that means that there has always, frankly, been a price tag on your health. And so what that has done is it has created a lot of different sort of tangents or aspects of how your healthcare system works and functions and operates within itself. And frankly, it ended up being an environment that honestly was sort of ripe, if you will, for abuse. And in some cases, downright theft. Because they were able, and I guess I'm directing this mostly to like insurance companies because that is how the system evolved, right? First there was something that was offered as a service, and then when more and more people needed the service, and they couldn't, afford the service the way it was being charged out, then of course insurance companies stepped in and they started, creating packages or bundles that allowed you to get the service and protection you need. I mean, really not unlike car insurance or house insurance. So, but in that process, of course, they control how it's going to be paid out and to whom it's going to be paid out and how much is going to be paid out. Again, not really that different from, your car insurance. If you get into a car accident, your car is wrecked, you don't get to tell the insurance company, this is how much my car is worth. They do an assessment, they do an appraisal, they figure it out, and then they say, this is what we will pay you to replace your car. Even though you met all of their terms in terms of paying your bill, they still have that overall right to establish the value of your car, therefore the value of the money that is going to be your settlement or your claim. And so when that happened, you had put in place a larger body that basically says yes or no to you. Okay, so that's the premise. That's kind of how we got to where we are right now. And what you have found is that it doesn't really work that well. It's not working for the vast numbers of people simply in your country. And I'm not talking about whether you like Obamacare or whether you like your work insurance, or I'm not talking about that. I'm just talking about overall the energy of the system. So as there were more and more people, as the population grew and grew and grew, and frankly, because of the evolution of time, people got sicker, but they also lived longer. And so on the one hand, there were advances made on, keeping people healthy and strong. But on the other hand, treating some of this stuff became really expensive. It required a great deal of knowledge, wisdom, insight, etc. So the whole thing just exponentially got bigger and bigger and bigger until it grew into one of those really, really huge industries within your country. And so now you've come to a place where you have more and more people who are, frankly, being left out in the cold. They're suffering, they're sick, and their needs are not being taken care of because you now have a situation where what is a private industry, and even if that industry is on the stock exchange, it still functions as a private industry in that its directive is profit. And whatever needs to be done to profit is exactly what they're going to do. So therefore, the whole premise of good health care And that being the priority really it's not on the top three of the list, okay? It just isn't important because it is very much viewed as a business. So what that has done is that has, again, created a situation where you have the haves and the have-nots, okay? And so now your country is trying to figure out a way forward. You're trying to figure out a way how to make the Medicare system, your medical Obamacare, your health care system. You're trying to figure out a way to make that move forward, but work for a lot of people. And right now, there's a lot of push and pull about how that's going to be done. Some people want to sort of take a leap of faith. They basically want to bring everything down, tear it apart, and then rebuild from scratch. Not necessarily a bad thing. Other people want to take the existing system and try to work within what is already established and refine it and streamline it and sort of move it away from that all business, only business paradigm. Part of the problem, part of what governments look at as they look at trying to solve this problem is that your insurance companies are massive, massive, massive corporations within your country. And if you take this system and sort of with one fell swoop sort of just replace it, what you're going to end up doing is having a lot of maybe unintended consequences or maybe consequences that are not being given enough consideration, right? So that's part of the problem. Part of what they're trying to figure out is how do you do this without completely kneecapping insurance companies because, you know, they do provide employment for people. They, you know, there are things that they offer in terms of the economy separate and beside medical care. The other side is saying if we don't get big corporations out of this, you know, we're never going to have a system that works. And then somewhere in that middle, you have this whole, and I'm telling you, I don't understand it. This whole idea of, well, if you go with this system, you don't have your doctor, but if you go with this system, you do have your doctor. And I have to tell you, that confuses me. I don't understand it, and I'm not going to pontificate on it. But so there's this perpetual push and pull going on in your country right now over the whole healthcare system. So let's see if we can figure out where this is going forward. And again, I caution you to please not take anything I say as an indicator of a political result. So, what does the United States' health care system or systems look like, going forward? What is the most likely way that this is going to be able to move forward? I mean, you know, you have to fix it somehow or another, right? Because you are paying so much more than any other country for your healthcare services. And, you know, frankly, for the most part, they're not as good as there are in other countries. And I am not for a second suggesting that you guys don't have some amazing medical centers in your country. You do. And you have some amazing doctors. How available is it? So here we go. U.S. healthcare going forward, U.S. healthcare going forward, U.S. healthcare going forward. Okay, so again, this is a focus. It's an area. It is important to a lot of people, and I think it's important to a lot of people whether they have what they believe is to be good health care or not. because even though they might have it, maybe their brother or sister, their child, their parents don't have it. And so it seems to be a real prominent concern within the energies of your borders. And of course, you know, the country as a whole. So there's a lot of hope being pinned on this change. There's a lot going on. People are really wanting this to become a primary motivator with the priorities. People want this to become a priority within the country. And there is an awareness that on the one hand, you have one political party that is literally systematically trying to destroy it and tear it down. And it's for a couple of reasons. One is because there's simply this incredible backlash over Obama and the Democrats' view of healthcare. And part of it is you have a party who really, really does have I don't know how it evolved, but these days, the Republican Party really does seem to have this attitude of, if you can't afford it, you just can't have it. Pull up your pants and get your work done and quit, taking advantage of the system. That's sort of the energy that comes off of that other party, intended or not. So there's a lot of hope, and there's frankly a lot of infighting. There's infighting within each individual party of how to accomplish that. And then, of course, there's a lot of fighting going on between the two parties about, how that should get worked out. And a lot of it has to do with cost. And a lot of it has to do with the fact that this system was built on a foundation or within a framework that is no longer, frankly, viable in the country. There's been a lot of suffering. There's been a lot of pain. And the scarcity. Okay, so whether it is the scarcity, again, going back to the insurance companies that control the price of pharmaceuticals, or whether it is a insurance company that is charging you thousands and thousands and thousands of dollars to just have a baby. So there's been a lot of hurt and there's been a lot of suffering created. And make no mistake, there has also been a lot of money created, a lot of affluence created. And for some people in your country, it has frankly saved their lives. Now, whether that's what has saved their lives is through Medicare, I'm not knowledgeable enough to speak to, but I will say that there have been plus and minuses on both sides. I mean, for every person who will tell you a story about, this healthcare system ruined me, or somebody died, I know, because of inadequate care or no care, there's always the other side of the story saying, I had a triple bypass and I wouldn't be here without the medical care I received, be it through Obamacare or whatever. Okay. So there's a lot. This is not going to be a simple solution, I think, is the bottom line of what I'm trying to say. It really does feel as if you want change and you want it quickly. But when it comes right down to actually figuring out the logistics of making the change without causing significant issues, is still being worked out. And it's going to take a lot of really smart people from a lot of different areas coming together and really brainstorming and really, really figuring out how do you take a really big something away from an industry and put it into a format that is not so reliant on that industry, but continues to be able to thrive and flourish on this side without this industry completely collapsing. Okay. And I don't know, maybe somewhere down the road, there will be kind of that blended system. And again, I can only speak to what we have here in Canada. Healthcare is provided for every man, woman, and child in this country free of charge. It is just part of the taxes you pay. It is, it's just part of the cost of living in Canada that is covered. Now, Are there employment insurance? Yes, there is, because what that allows you to do is upgrade the kind of insurance you have or get more additional coverage for things that aren't necessarily covered. It is what allows you to get your prescription drugs covered through insurance. It is what allows for hearing aids and glasses and that kind of thing. So, maybe it may be that somewhere down the line, what is lost from the insurance companies on one side will be gained through these other means. I don't know. I just know energetically that you cannot take down a massive, massive industry within your company and just not expect it to have consequences that are perhaps more far-reaching than initially intended. So what does the future for Medicare look like? Like what does it look like going forward? Where are we going to be a year from now, 2 years from now, 5 years from now? What is it going to look like? All right, well, so there's going to be some really hard decisions that need to be made, and for sure, there's going to need to be a lot of compromise that needs to be made. It really, really seems to be that there's going to need to be a coming together of ideas and attitudes, hopes, opinions, and try to craft something that is new, that doesn't look like what you have now. Does that mean it's going to look completely different than what you have now, or does that mean that it's going to be an amalgamation? It definitely looks like there has to be a coming together. First of all, there's going to be a lot of misinformation, miscommunication, and this is the problem, right? The whole healthcare debate, if you will, just fires up so many passions, and there's so many different ways to look at it. And people have very, very passionate feelings about how they feel about it. And because of that, you also get a lot of misinformation or confusing information. And I go back to, the whole thing that happened around the Obamacare. And it wasn't until Obama left office that people actually started to realize that, oh, wait a minute, this Obamacare that I am rallying against is the, what is that, the Affordable Health Care Plan or whatever that I like. So they were the same thing, but there was all of this miscommunication around it. And so that's what you're getting now. So part of it is that people really, really have to be cautious and careful about where they're getting their information from and ensuring that it is accurate, because it's ripe for miscommunication. So this is what you're going to have, right? You're going to have some portion of the people, sort of suggesting that a medical care system for, everyone, and they're going to start screaming socialism, which is a trigger word in your country. It really does tend to get people sort of riled up one way or the other. So that's going to be part of it, right? There's going to be miscommunication, and there's going to be, frankly, on both sides, you're going to have some aspects of the far left sort of implying or suggesting that they can fix everything in one fell swoop and it's just going to be fine. And then you have that other group who are kind of in the center, and they are saying sometimes it is better to take consistent steps forward than start a revolution. Then there is the other part of the country that are saying, hey, if you can't afford it, why don't you just pick yourself up and get yourself into a position where you can afford it? And by the way, if you really, really can't, and it's going to be covered by the government, well, guess what? We're going to cut those services left, right, and center. So you can see there's not a sort of path forward, okay? It's not clear. There isn't real clarity on how to get going forward at this time. That's fair, given everything that's going on. So, eventually, in time, and again, timing is a very, very, very difficult thing. in any sort of energy work, but it seems that tarot is especially difficult. I want to say 3 to 5 years. Okay, within 3 to 5 years, you're going to have some real clarity going forward about exactly how the system is going to come together. And that's going to happen because even if sort of the Bernie Sanders, if you will, of US politics are elected, he's not going to be able to move forward with sweeps because he'll get blocked, because there are people who are going to be having their constituents yelling and screaming about, I don't want to lose my doctor. Why are you taking us into a socialistic, way of hospital care? So it's not going to move fast. And part of the reason it's not going to move fast is because, frankly, there needs to be a coming together. There needs to be some compromising going on. And right now, that is a really, really hard thing to achieve because of the energies going on within the country. But there is going to come a balance. Rest assured, there is going to come a balance. Rest assured, eventually, people's compassion and their ability to understand that, you know what, maybe it's not, maybe I'm fine, maybe I'm good, but my neighbor isn't. Or, my sister's child has been born with a birth defect. How do we deal with that? My grandchild. So there has to be this coming together, and eventually it's going to come together. But you know what? It's going to take some really, really hard looks at sort of where the money's going, where the resources are going, what things have been just accepted because they've always been that way versus what actually works better. But there's definitely a coming together. You have Temperance here, you have the Lovers here. You're talking about it coming together ultimately for the betterment of all. But again, I repeat, there has to be a balance. You got to figure out a way to accomplish one thing without completely destroying something else that maybe needs to be altered or adapted, but completely destroying it would not actually serve anybody either. But there's growth. There is growth in this area. It is going to come forward. It is going to move forward. And I have to say, energetically, 3-4 years down the road, what I'm looking at is honestly a real interesting blend. It is not all left. It is not all right, and it is not all in the middle. It is as if the elements are coming together. It is as if people are starting to understand that this is not going to be a fight and it can't be a war. It has to be collective. We have to come together as a country and try to, at least to some degree, figure out what will help the most number of people and start to move forward to making that happen. And there's a lot to be looking forward to, okay? This system is not going to fail you. Even between now and the election, if it appears as if the Republicans are starting to make some really, really powerful moves against it, should that happen, it will either be reversed or blocked. So if it actually manages, I think a lot of it is going to be blocked in the courts, but anything that actually does manage to get through is going to be reversed with the next government. There's movement forward. Don't lose hope. There's movement forward. And again, it's about money, okay? It's about who has it, who doesn't have it, who can afford it, who can't afford it, how much is this costing the government? Literally, what is it that you people pay on an annual basis for health coverage and care of the citizens, the people of your country, in relation to what other countries pay for, and how can you kind of try to get your stuff back into alignment, I guess is the way to say it. So, I guess what I'm trying to say is don't lose hope. There's going to be victory eventually. You're going to end up with a healthcare system that as a country you can be really, really proud of. But it's going to take work. and if I'm annoying people out there by saying it's not an all or nothing, well, I'm sorry, but I'm seeing what I'm seeing, and what I'm seeing is the fact that this is really going to have to be a collective. People are going to have to come together from various areas of medicine, and be that pharmaceuticals, be that mental health, be that drug addiction, be that cancer treatment, whatever it is. Those different components have to come together, as do the different areas of government have to come together to try to create something that is going to be workable for the people. And once that hard work goes in, you are going to have success, and ultimately you are going to end up with a healthcare system that I think you'll be happy with and proud to have achieved and accomplished. So, again, thank you so much for the support of this channel. I appreciate all of the subscriptions, the thumbs up, the comments, and I hope you found that interesting and insightful, and I hope perhaps it gave you a little bit of hope. All is not lost. Until next time, take care, be well, we'll see you soon. Bye.